But after that, hey, we have to be in the field, but I'm not losing any weight, up and down, but nothing.
Formally and officially start our standing committee meeting on Wednesday, the 12th of August 2020. I wish to welcome all members present, all officials of the department present, and all guests are heartily welcomed to the standing committee meeting this morning. Members, I believe that we are fairly clued up with the rules of engagement virtually by now. So I would ask all members to kindly mute themselves, also to put off their cameras. You are most welcome, members, when you address the chairperson to unmute yourself, as well as to turn on your video. Also, the chat function on the right-hand side, members, can I please ask that we do not use the function for chatting or saying good morning, but rather raise your point of order or draw the attention of the chairperson accordingly. Thank you for your cooperation in this regard, members. We also have the department, the Western Cape Department of Health, present this morning, and all members are now, and guests as well as the department, are now duly welcomed to this meeting. In terms of our proceedings, I will now request all members present, all department officials and guests to kindly introduce themselves for the record in that order. You may proceed, members.
Good afternoon, good morning, Chairperson Regan Allen.
Good morning, Chairperson and everyone. Rachel Winvogel.
Good morning, Chairperson Gillian Postman. I'm an alternate to this committee and I'm standing in for Member Lorraine Porter this morning.
Thank you, Member. Any other members present? The department?
Good morning, Chairperson. I'm Keith Clutie. I'm the head of department. Thank you, Chairperson.
Good morning, Mr. Clutie.
There's a Dr.
Any
Balab.
other?
Dr. Balabji will introduce himself, Chairperson.
Good morning, Chairperson and members. It's Krish Vallabhji. I'm the Chief Director for Strategy in the Department of Health. Thanks.
Thank you very much, Dr. Vallabhji. Any guests present this morning?
Good morning, Damaris Kivitz, Cape Metropolitan Health Forum.
Good morning, Ms. Kivitz, and a warm welcome to you as well.
Good morning, Chairperson.
I could not
Mr. Sean Stacey from the Minister's Office. Thank you, Chairperson.
Thank you very much. Welcome, Mr. Stacey. Any other guests or department officials? None. Thank you. I also wish to tender an apology for the Minister of Health, Dr. Noma French Bombo, who unfortunately has another engagement today. And as mentioned by Member Gillian Bosman, who is standing in for Member Lorraine Botha this morning. Colleagues, the purpose of today's meeting is for the department to brief us on the functioning of the clinic committees and the hospital boards in the province in accordance with the Western Cape Health Facility Boards and Committees Act of 2016. The committee resolved to schedule this briefing after the community health stakeholders raised concerns about the implementation of the Western Cape Health Facility Boards and Committees Act. Accordingly, so during the public hearing on the annual report of the Department of Health in October last year, the committee then took a resolution to request a briefing from the department on this matter. And in addition, the committee has an oversight responsibility to monitor the implementation of the legislations by the department. I also wish to inform all members and department officials that this committee has received a request from the community health forums to be allowed to give input and pose questions to the department during this meeting. Members, we have heard that Ms. Kivitz, representative of the said forum, is present in this meeting today. Ms. Jamke, our procedural officer, must just assist me in terms of the date on which the request was received. And of course, members, we are most open and welcome in terms of our mandate and our responsibilities, as well as our powers and functions, to always gladly receive the input of those entities and forums directly linked to the community. I do believe for the purpose of this engagement, the request was received a bit late, and I think we do have also the responsibility to alert the department accordingly in order for them to also adequately prepare themselves for such engagement. So I believe that we as a committee can then take a resolution in terms of a follow-up engagement. We will then request from the said forum exactly what it is that they want the department to report on, and then give adequate time for the forum to then engage this committee. Besides the briefing by the department, we also have 7 pieces of draft committee documents that we need to resolve today as well. So, Ms. Kivitz, is that ruling in order with you?
Chairperson, for the record, the committee, the Cape Metropolitan Health Forum, has since 3rd of June asked for an engagement around this issue, not just for where committees are, but also the role of committees with the response to COVID-19. I hear what you are saying, and also at each APP and annual review session, that is what we as the forum highlights and ask the standing committee for this briefing. It's unfortunate that we didn't get the notice in time. Therefore, I could only do my request on Monday when I went onto the website to see what business is there that the standing committee is addressing that would be of our interest. So we would agree with your ruling, and I think we will not do a follow-up request, but that the standing committee take a decision to bring us back as the forum and the standing committee and the department on this specific engagement, if there's not going to be a time for us to address the department on this issue that speaks directly to our core business.
Yes, thank you very much, Ms. Kivitz, for your input and for your understanding. I must perhaps just make myself more clear. Once again, thank you for taking this opportunity. And I think once again, it's very, very important that you do engage with this committee and do engage with the department. For the sake of time and for the sake of the department preparing themselves, I am sure that there will also be specific issues that you would want the department to address. So we really want a very productive engagement at that stage. You are here today, Ms. Kivitz, so I will grant you an 5-minute opportunity to address this committee on exactly what it is, since we will be sending you the invitation now to be part of that not distant future engagement. I will grant you a 5-minute opportunity to address the committee in order for us to resolve exactly what the forum will be engaging us on come the next engagement. Member Van Vogel, I recognize you.
No, I think you covered me, Chairperson, because my view was Mrs. Damaris is with us. Why didn't we give her a few minutes? So, but you covered that part. Thank you so much, Chair.
Thank you. Not going, meaning not going into specifics, because we would have needed the department to prepare themselves accordingly. Thank you very much, members. That is now concluded. I will now then proceed and ask the department to kindly proceed with their presentations, members, after which we will then pose questions accordingly based on the presentation. You may proceed. Thank you.
Thank you, Chairperson. Can you see the presentation?
Yes, I can see. Thank you, Dr. Klute.
Thank you, Chairperson. I'm just going to put it on slideshow and then I will proceed. Thank you. So thank you very much, Chairperson and the committee for this opportunity. I will be providing an update on the implementation of the Western Cape Health Facilities Board and Clinic Committee Act and the regulations. And I'm joined by Dr. Vallabhji, who has done most of the preparation with the inputs from officials in both metro and rural health services. So I will start off with introductory remarks. I will then give an update on the regulations and delegations. Then we will give you an up-to-date figure of what the current status is of these different facilities. Also a training update. And then to go into the challenges and with some concluding remarks. So the introductory remarks, community involvement in health is obviously recognized globally and also locally as a key ingredient to well-performing health systems. So community involvement in health is part of the vision of our Department of Healthcare 2030, and that a functional statutory structures are key enabling mechanisms for this. But I think the point we're trying to make is community involvement in health and the structures are not the same thing. Community involvement in health is a very important thing that we need to strive for. The structures is a mechanism to enable that. The legislative framework, which is the Western Cape Health Facility Boards and Clinic Committee Act of 2016, which is Act 4 of 2016, and then the associated regulations have therefore been put in place. So let me just touch on the legislative and the regulatory framework rapidly. I think most members would be familiar with this. Where it comes from, number one, from the National Parliament, there's a National Health Act 2003. That's Act 61 of 2003. There's specific sections in there that deals with health facility boards and clinic committees. In the Western Cape, specifically, from the Western Cape Parliament is the Western Cape Health Facilities Board and Committees Act of 2016. And just to indicate to you our architecture in our department, Western Cape specifically, Department of Health, is that there are 52 hospitals in the Western Cape. There's 462 primary care service points, and there are 14.4 million PHC visits per year. There's at least one hospital in each sub-district with collectively more than 9,900 beds. I think out of the Act, the big thing is Section 41 and Section 42, boards to be appointed for hospitals, and then committees to be appointed for clinics and community health centers. So the purpose of the Act is to create boards and committees that allow for, number one, community support in facilities program. Number two, ensuring responsible use of resources at health facility level. Number three, responsiveness of the management of health facilities to community needs. So the clinic committees are clustered. The provincial minister must determine the group by having regard for, and two, the geographic distance between primary care facilities, the size and distribution of the population served by these facilities, and then the service volume of the primary healthcare facility. So there is a provision made for the grouping and clustering of these committees. The regulations, the Act was passed by Western Cape Government on the 5th of July 2016. Regulations was published for public comment on the 20th of April 2017 to the 31st of May 2017. There were 3 sets of regulations. The first one is financial governance. The second one, criteria and procedures for clustering of facilities. And the third one was the process to call for nominations. The regulation was then signed off by the minister in the latter half of November 2017, and the Act and the regulations came into effect on the 7th of December 2017. The minister was empowered to cluster facilities, which was signed off on the 1st of January 2018. So delegations, Section 29 of the Act provides that the provincial minister and the head of department may delegate the powers and assign the duties they receive in terms of the Act. There's a circular that we have now issued, a circular H47-2019, and there's a review of the delegations, and that final draft is now ready to go out. So the structure of new facility boards and clinic committees. Committees, not more than 12 members in total. 1 or more municipal council for the area of the clinic. Community members is 50% of the total number of members in the committee. The head of the facility or clinic or a manager designated by the district health manager serves on that committee. And all must be South Africans of 18 years and above, and that's contained in Section 6 and 7. For hospital boards, 14 members in total. 1 or more municipal councillor for the area of the clinics. Community members, 50% of the total in that board. At least 1 person with technical expertise in business, law, finance, or accounting, or an area relevant to the board. The head of the hospital or person representing clinic staff and every hospital concerned. At least 1 person representing clinical staff, at least 1 person representing non-clinical staff. And a member of provincial parliament or municipal council may be appointed. Again, South Africans 18 and over, and the sections 5 and 7 speak to that. So let's go to the status of the hospital boards and clinic committees. So the provincial overview of clinic committees are the following. There are currently 65 functional committees, 26 in the metro, 39 in rural. So those are the functional committees. There are 13 places that has been constituted, but sorry, they're not functional, sorry, or the functionality is uncertain, or they're functional, but they're not properly constituted. So there's a combination that lives in that, and that's 13 facilities. I'll explain that. So it's 4 in the metro, 9 in the rural. So they're either not functional or the functionality is uncertain. That means they don't meet regularly in accordance with what's expected. Or they're functional, but they're not properly constituted, which means they are meeting, but they don't have the full membership in terms of what is expected. So they are missing members in terms of full function, fully properly constituted. So that is that group of 13 facilities. Then the ones that's not been constituted or not functional, and that is 77 in total. So in the metro, there are 15 of those, and in the rural, there are 62 of those. So just to give you an overview per district. So if you take the total, that's why I said to you 65 functional, 13 constituted but not fully functional, and then 77 not constituted and not functional. In Garden Route, the breakdown is 10 functional, 6 constituted non-functional, and then 13 not constituted non-functional. Central Karoo, it's 402. Cape Winelands, it's 17,116. West Coast, it's 5,116. Overberg, it's 3,115. And in the metro, that's obviously where the majority of the places are, 26 is functional, 4 is constituted but not functional, and then 15 is not constituted and not functional. And then all clinic committees expire in June, August 2021. So that's an important date to remember, because that is where we're sitting now, 12 months from where we are now. If you go to the hospital facility boards, the overall purpose of the board is to ensure accountability of the health facility management to the community and the responsiveness to the needs of patients and their families. Again, there are currently functional 33 hospital boards, constituted, not functional, or functionality uncertain, or functional but not properly constituted. There are 4. There are 3 in the metro, 1 in the rural. And then non-constituted or not functional is 8, 2 in the metro and 6 in the rural. So again, the total is 33 functional boards, 4 constituted but not functional, 8 not constituted, not functional. And the overview of that is in Garden Route, there are 5 functional boards, 1 constituted, not functional, 1 not constituted and not functional. Central Karoo, all 3 hospitals are functional, 0 for the others. With Cape Winelands, 5 are functional, 1 is not constituted. West Coast, 3 is functional, 3 are not constituted or functional. In Overberg, it's 3 and 1. In the metro, 14 are functional, 3 are constituted but not functional, and 2 is not constituted and not functional. And then extension of terms of boards. Now, according to section 8.2, on the expiry of the member, that member may remain in office until a successor has been appointed, but not for longer than 6 months. Recently, 18 extensions have been made until the end of June, July. There's investigation into further extensions in light of this National Disaster Act currently in practice. So the intention was that we needed to have a new round of appointments. We now are looking at further extensions because of COVID. We're finding ourselves in the middle of COVID-19. Appointment letters, all appointment letters sent to facilities and the metro and the rural office, and via that to the respective members and the institutions where they serve. Just a training update. The national material has been adapted to include Western Cape legislation and regulations. That's on the national health system, health in context, health governance paradigms, information skills and values relevant to the role of health governance structures. Pilot training was conducted in the metro for 2 groups in January and February this year. Clinic committee members from 4 substructures coordinated through PHC managers. 69 members were trained in the metro. All formal training is on hold now due to COVID-19. Small group activity is essential for the success of the program, according to the facilitator guide. So there's not been any training since the advent of COVID and the Disaster Act. There will be evaluation to learn lessons before there's full rollout. So I think the big issue, Chairperson, is this is a very good time for us to do an evaluation, and we really thank you for the opportunity to have this conversation with you, because we are in the place where we want to actually take a fresh look and see what we've learned in this process. So the COVID training for clinic committees and boards. As the epidemic grows, health committees and boards can play a key role in critical tasks needed to address the epidemic. COVID training of health facility boards and clinic committees is therefore being planned. There's something called Pack Home, which is a practical approach to care kit, which will form the basis of that training. The possibility of training by webinars are being explored, and access to electronic medium a challenge for some community members, and alternatives are being explored. So we're actively looking at using the pack home as a practical guide to get involved clinic committees in COVID. Implementation challenges. The interest amongst communities to volunteer has varied. The teething problems to get full functionality of committees, inadequate number of members that's been nominated or people that have stepped forward, lack of quorum for meetings, etc. So there's a range of teething problems for the functionality of committees where we have sufficient members. But the other one is also getting sufficient members to serve. Then challenges related to the appointment of councillors. That was a specific challenge because the Act then asked, and we had to go via municipalities, and it was a specific challenge for councillor appointments to be confirmed in each of the individual facilities. Then the lack of remuneration is seen as a disincentive. Many cases, lack of remuneration has been cited as the reasons why people are not stepping forward to serve on these committees. And then processes within the department itself required streamlining. So there was quite a cumbersome process, and we're quite open about it, Chairperson, internally in our department, from local sub-districts all the way to the Minister's office, back down to the facilities, back to members. It was a cumbersome, complicated process. And we had to take some time to streamline that. And Dr. Vallabhji will also just highlight some of the things we did in terms of reorganizing and rethinking this function within the functioning of the department. So just in concluding remarks, I think, Chairperson, all of us and we as our department can look at COVID from different perspectives. From where we're sitting now, while we were in the middle of COVID, it was one of the biggest disruptive influences that any healthcare system could have. You could see the evidence globally that what COVID has brought to a healthcare system has rocked the healthcare system globally to its roots. It's also not just rocked the healthcare system, it rocked the entire society to its roots. The impact of COVID is going to be felt for many, many more years. For the lessons for us as a health department within our department, we recognize that COVID has been a big rock for us. It rocked our systems. But in hindsight, we can look through this now and say, one of the biggest things we gained from COVID is that it gave us an opportunity to learn and reflect on how we do business. And we must say, we have taken the latter as the approach out of COVID. So we really are using COVID as a realignment and a readjustment process for ourselves. It's learning, and it's really asking us to ask us questions on everything we do and how we can do it better. There's also been that experience, and then previously of what we call the WOZA pilot sites to inform a broader approach to community involvement will be explored in the next few weeks. So we've also learned in the 4 pilot sites previously, we have shared with this committee those pilot sites. We learned in Saldanha, we've learned in Drakensberg, we've learned in Khayelitsha, we've also learned in the Klipfontein area. We've drawn from that lessons, and we believe between COVID and what that lessons, there is a broader approach to community involvement that's emerging, that is now coming right up onto the surface for us as a department. So we are in the next couple of weeks doing a detailed reflection of how we've experienced COVID, but out of COVID, how can we actually look at what we do differently? One of the biggest reflections for us internally as a department is we want to reflect on community involvement, and we want to explore it in the next few weeks. So I will make a proposal to Ms. Fritz and to all other structures outside, is we actually want to engage to say, how do we reflect on community involvement as a department with our structures to say, what do we learn from it, so that we use the opportunity of the next few weeks as a very clear opportunity for us to learn about how to strengthen community participation from September onwards, or from August onwards, from September onwards. But that's really the idea of what we wanted to create. We have agreed to create a focal point within our Directorate Assurance for statutory structure support. So it's in Dr. Vallabhji's Chief Directorate. We have a directorate called Assurance. That's the directorate that's headed by Mr. Mabela. And in there, you have the licensing function, you have the quality assurance function, you have the function for mental health review board, you have a function for the Independent Health Complaints Committee. So we have that structure, and we felt that it would be an important part for us now to create a focal point for community participation for statutory structures within that directorate. So also with Mr. Mvela's unit, we are looking at that capacity. This will form an important interface between the decentralized structures at district and facility level and also the Minister's Office. So capacity to support the structure will be addressed via the micro-design process of MEEP. Again, it's another process to the committee members, Chairperson. We have indicated to you before, and at some point it would be also good for you to understand how far we got with MEEP, and that is our internal restructuring as a department. But the thinking is here, as part of that restructuring process, we are now creating a focal point for statutory structures. We have put some interim arrangements in place, so there's already some focal capacity to be able to do that. The last third bullet is a software program to digitize and to streamline the appointment process for clinic committees and hospital boards is currently being refined. So it's an online streamlined process that will make it much simpler and easier for the appointment process. Then the last one is that the architecture has been laid between clinic committees, hospital boards, district health council committees, but we need, in partnership with communities, to bring them to vibrant, active structures. And I just want to leave you with the last point. We had a meeting and an engagement. We have two engagements around the department's approach to universal health coverage. One in September with the private sector, where the community structures and the Cape Metro Health Forum was invited to. And we had one in January in Godini Spa. And it's really for us an opportunity now to say, if we all focus on universal health coverage, we all focus on governance for health, we all focus on actually impacting on the lives of citizens, it's a good opportunity that the structures is not just a means, it's not an end in itself. It's a means towards universal health coverage. It's a mean toward community-oriented primary care. So we're really in an exciting window, I think. And I can give you a guarantee, Chairperson, as the head of this department, I've been the head for 3 months. I can give you the guarantee, sorry, it's 4 months now, I apologize. I can give you the guarantee that we are open to be really, really open to any engagement, to learn, but we take community involvement in healthcare very seriously. Thank you very much, Chairperson.
Thank you very much, Dr. Klute. Dr. Vallabhji.
Chairperson, we largely covered. I think Dr. Klute has referred to the streamlining that has happened within the department. Like he has said, it was initially quite cumbersome. Towards the end of last year, we then appointed Sean, who is on this call, in the Minister's Office to try and assist with that streamlining process. And then upon a subsequent reflection, we agreed that even within the department at head office, we needed a focal point. So that's the point that Dr. Klute has referred to. It has now been newly created in the Directorate Assurance, and we just need to get some capacity in place. And that would then become the key interface between our people on the ground working at facility level and the Minister's Office. But also within head office, there are multiple touch points. So for example, people management undertake the training aspect. There's a policy aspect. There's a legal administration aspect. There's connecting with the services. There's an IT aspect. So this becomes the focal point that brings all of that together and coordinates. And hopefully that will then make the processes much more efficient and productive in that way. Thanks, Madam Chair.
Thank you very much. Is there anyone else from the department, Dr. Kluter?
Chairperson, for today, we
wishes to make an input, or can we proceed?
Chairperson, we can proceed. It's only Dr. Balaji and myself. Thank you very much.
Thank you very much for the consideration. Proceed to your post questions on the presentation made by the department. If you don't answer, show of hands, I will then recognize you in order to post. My question to the department, in terms of the review of delegations 2020, what that process entailed, and with the final draft going out now, just to give us an understanding. My second question on the functionality and the non-functionality, that impact on the functionality of a health facility, and what is the department's role in ensuring that those boards and committees do operate optimally? And then my third question would be, and I'm very happy and glad for the assurance in terms of your commitment to community participation as well as community involvement in the entire health structure within the province. What is the timeline set by the department for the training of these entities? That is, conclude with that. 3 questions for now. I recognize Member Regan Allen.
Thank you so much, Chairperson, and thank you to the department. Obviously, Chairperson, I understand community involvement and the avenues that a community can use in order to not only foster relationships with the community, with the clinic or the hospital, and how that can help. But I wanted to check from the department, and latching onto your question regarding the lack of community interest, which could be cited as a reason why a health committee is potentially struggling. Is there then anything from the department side to help and assist in that regard? But also then for the councillors, do we have a breakdown of, in terms of the functional and the non-functional committees, do we have a breakdown of at least of who the all councillors sitting on that committees? Do we have any feedback in that regard? But then just the last one, let me just go to my page. Okay, that's all for me for now. Thank you, Chairperson.
Thank you, Member Allen. I recognize Member Barnes.
Thank you, Chairperson. My apologies for coming in late. I'm having problems with technicalities in case I disappear while I'm talking. I first want to start thanking the HOD with his closing remarks, where he said that we are rocked as a department on health and the society by COVID-19. Truly so, I appreciate the style that he has led for the 4 months he has indicated, because myself, I can say I can attest, like I've seen the difference. However, I want to ask 1 or 2 questions. My first one would be, I'm not sure if it was asked, like I said, I'm going in and out of the meeting. I'm not capturing everything. There was a slide speaking about the appointment of members of parliament into the boards. Who gets to do that? Second to that, there was a slide speaking about functionality of the boards, of the health boards, non-functional and functional. What I want to know, how do you define, or how do you know that this one is functional or not? Because I've seen, for example, in the Karoo, it was saying 4 functional, 402, while where I am, I'm confident because of COVID, running around, even speaking to the HOD's office, wanting assisted, that I was struggling to get hold of the boards to assist within this period. My last question is on training. Like I said, I'm not sure if I missed out on that slide. If there was a tender out for training, or if there is a training report that tells us what happened around training, I need guidance on that as well. For now, I'm covered, Chair. Thank you very much.
Thank you very much, Member Barnes. I recognize Member Bosman and then Member Windvogel.
Thank you very much, Chair, and thank you to the department for the information as well. I just wanted to find out, Chair, what specifically the hurdle was around the appointment of councillors. Is it that it needs to be a decision of council, or is it the delegation of the executive mayor? And is it that that process is taking long? And I wanted to ask if the department has explored the option of having specific ward committee members that focus on health, who then maybe become the members who sit on those boards, because each ward would have a health representative as well. Thank you.
Thank you very much, Member Bosman. Member Van Vogel.
Thank you, Chair. Chairperson, I also want to welcome the presentation by the HOD, and I just wanted to say thank you to HOD. You guys have done well during this past few months. Chairperson, mine is on the issue of people who are not interested to serve on the different boards, the hospital boards and the health committee boards, committees. I'm just wondering in terms of advertising, because I know in my area, normally they send it to the hospital and the public is not really aware. Are they using local newspapers? I just need clarity on that one, Chair. And then the other thing, Chair, is that perhaps if it is possible that the HOD can, or he and his team can give us clear guidelines in terms of how are they going to, because he point out the shortcomings and the problems, how are they going to rectify that? Because as reported, there's committees who are functional. Can't we copy good practices from those committees who are functional, and at least get by timelines? By when will that happen? Because this structures is very important, especially during this time. So I need something that will tell us we will implement from this date up until that date, 1, 2, 3, and 4. So if we can get clarity in that regard, Chairperson. Chair, then I really need to get a sense, or at least a report, the training for these structures. What type of reports of what type of training was given, when, a type of report, the support that the department is giving to these different structures. I'm also struggling with network, so if I missed that part,
Thank you very much, Member Van Vogel. I think quite a few of us are sitting at the edge of our seats because the weather is not so good. Members, that now concludes the members' questions. Member Barnes, can I ask that you please lower your hand? I will now afford the department to please respond to the questions raised. Thank you.
Thank you very much, Chairperson, and thank you for the kind words from the members. It's really appreciated. So thank you for that. Let me start off, and I will leave many of the technical answers to Dr. Vallabhji. So I'm going to give an overview of many of the themes, and then Dr. Vallabhji will go into a little bit more specific detail. And if need be, he can decide whether Sean needs to go into additional feedback. I think the delegations, Chairperson, I think Dr. Vallabhji will give you an indication. But what it basically means is that the minister and myself, in terms of the Act, has certain delegations of how to give effect to that. So within our department, when it is for all our other functions, the minister's function, my function, we have a framework where we decide how that delegations are distributed through the organization. So it's a general principle. So when the minister appoints staff, we use the minister's delegation to give other people like district managers, facility managers, specific delegations, but it has to be specifically delegated to them. So you understand, when it comes to me, I can, as the accounting officer, order certain amounts and pay for certain amounts. I also use my delegations, and then through the delegation framework, give appropriate delegations right down in the system. So we applied a similar framework to the delegations in terms of the act for both facilities, for clinic committees and hospitals. And Dr. Balabji will explain the examples of what kind of things. And it's in the delegation framework is really about making sure that things run smoothly, but there's sufficient oversight. So you must get the balance right. That you can't just say you delegate everything down. It's about getting the balance right in the process right for sufficient oversight to make sure that the system runs smoothly. Then just in terms of your question, which is a very important one, so Dr. Balabji will go into the delegation. The functionality question is something that worries us because I would say and I think that was the point made by one of the other members, that where you have a functional committee, it enhances the ability of that facility to engage with its citizens. So it is absolutely 100% that the desired situation is a functional committee. So where we do not have functional committees or non-existing committees, the facility is in a lesser advantageous position to be able to serve the people. So our real impact that we have recognized out of this is the desire for us is to have functional committees everywhere. And we therefore are going to take, I think member Winvogel asked that question, can we have timelines? Can we have things in terms of taking all the non-functional committees and making sure that that's there? That is what we want to do in the next few weeks. We really want to use the opportunity of while we're now reviewing out of COVID, that we take a review on what would be realistic targets for actually getting back to functionality in all of the places. But you have to also be very cognizant that COVID is not gone yet. COVID is with us. So what does functionality mean in the time of COVID? And I think that's the point that member Barnes asked us. Because the point is functionality before COVID was everybody pitches for a meeting at the facility, they sit in the same room and they go through the items and they do that and they do it monthly. In the time of COVID, social distancing, masking, all of those is a reality. So how do we have continued functionality while we have COVID? And COVID is going to be with us for at least 12 to 18 months until there's a vaccine. So it's really about also defining what functionality means in the time of COVID. So we're very excited that the next couple of weeks is a time for us to define what it is and to be very specific. What does functionality mean? And we are going to be very much drawing on the experience of our social partners in the Cape Metro Health Forum and other civil society organizations to help us to say what would functionality look like and how do we actually put systems in place. The timelines for the training is the question that you asked, and it was also asked later. And I will also ask Dr. Balabji just to go a little bit more into the detail. But again, I just make the general point. There was training before COVID. What has happened? What happens with training because of COVID? And COVID is going to be with us. So there's also a rethink in what kind of training is effective. So you hear the story of webinars, because now we are doing training for COVID, for functional committees. We have to think out of the box. Now, what we're doing with that, we then have to think, oh, but if that is what we're doing for COVID for functional committees, we now need to think of training for committees in the same way and radically rethink the way, the modalities for training and how we actually do that. I think the issue of lack of interest is a big issue from our side. We would like to know from community leaders and from community structures what it is that we should all collectively do to address the issue. Because for us, it is actually, if I want to put it to you, the people that I've learned the most from over the years, and you know, Ms. Kivitz is here. I know Ms. Kivitz very well for more than 20 years. I know Mr. Lindors for a long time. I know Polly Jacobs that preceded both of them and were like a mentor for both of them. That was a calling. It was a commitment to the greater good. We didn't have to convince Uncle Polly or a Mrs. Kivitz or a Mr. Lindors that to serve on a health committee, or serve on a structure, is in the best interest of the community and the society at large. We need to ask, how do we get back to that place? That it becomes a passion. It becomes something that we do because it's the right thing to do. I have to ask myself, I'm a health official, but I ask myself, I need to go serve I'm a citizen. So I'm serving on a board of small NPOs. It's got nothing to do with health, but I need to be civic minded. I need to do it because it's the right thing. So I think that is the biggest challenge for all of us. And it's not a challenge for the health department. It's a challenge of how do we go back to ask everyone. And COVID is a good opportunity for us because people are starving, people are disconnected. What is the greater good? How do we all build, let's call it, the important societal institutions we require? A strong civil society is a must. A strong community-led, action-orientated network of people is a must for our society. And that's what we ask of each citizen. So I really feel passionate about that. And I do think that we need to do it as a collective. We can give a breakdown of the councillors per committee. And that was the request from Member Allen. So we can provide that for the committee. And we can also give the feedback of the participation of councillors on the committees. So it would be useful to do that. And that's just linked to Member Bosman's question about what the difficulties was about council appointments. I think the big difficulty was and Dr. Balaji can explain a little bit more in detail, but the big thing was we had to approach the council. And the council and the executive committee of the council had to nominate people to serve on the clinic committees. And it's really what criteria they went through. But we were really waiting for council to say, and remember, we had to group cluster committees. So we then had to tell them, in your area of this council, these are the cluster committees, and the process that we then had to wait for them to give it. But Dr. Balaji can go into a little bit more detail in relation to that. Member Barnes' question about the MP appointments to the board. I think Minister Mbombo previously at this committee explained that process. I'm going to ask Dr. Balaji just again in terms of the regulations, just explain what is the process for the appointments of members of parliament to serve on hospital boards. Because I think it's quite important that we're clear about that process and how those nominations are processed and sent forward to us. I've covered the non-functional, functional, I've covered the training. Can I just then maybe just say that people not being interested to serve on committees. The advertisement was quite an expensive process. We went through quite extensive advertisements for community newspapers and local community newspapers. And it is something that we have to really reflect on. And I'm not sure what the most effective way is, but to find the most civic-minded people and to actually get that communication is something that we have to explore and find innovative ways of getting that out. And then the clear guidelines and timelines and training, I think I've answered those questions. So, Chairperson, if you don't mind, if Dr. Balaji can just go a little bit more in the technical detail of some of the answers, and if need be, then he can refer to Sean. Thanks, Chairperson.
Yes, thank you so much, Dr. Klute. Dr. Balaji.
So, Madam Chair, I think Dr. Klute has covered a lot on the delegation process. So really, this is now giving effect to the regulations, right? And these include things like, the kind of processes in the nomination and appointment process, etc., the financial delegations, how do we actually make that happen? Because if you would recall, the regulations make provision for the hospital boards to open accounts for the clinic committees. So what are the specifics of that? Who does what? Who calls the first meeting? So those are the kinds of things we kind of delegated down the system largely to district managers and facility managers. So that process was put in place and a formal circular was issued. However, we realized a few months later that because the department had also reorganized itself, for example, the regional hospitals now report to the chief director in the metro and chief director in the rural, right? So what does that mean for the processes related to how things flow in that? So those were the kind of adjustments and refinement required to the delegations. And like we've said in the presentation, that's almost ready to go out. So that's on the issue of delegations. As far as the functionality goes, we've been using the kind of conventional ways of assessing functionality, and these are attendance registers at meetings, availability of minutes, etc. So that's the in how you assess the functionality of these structures. But I think the bigger point is, how do we enable the functionality? And Dr. Kluti has spoken to that matter. And over and above the minister, who has really been a champion in trying to get communities interested, to try and get them motivated to step up, etc. And she does this in all her site visits, etc. So that's been a big thing. Well, like I said, we've created capacity in our office, and Sean is on this call, who's been appointed specifically to support this process. The training is another example. The training was
Dr. Vallabhji?
liaised with national. Then there was the concern about whether some of the specifics of our own regulations and legislation would be catered for in the training, because remember, national is for the whole country, and we've got specific legislation in this province. So we needed to modify some of the training materials, and then we agreed that we will pilot the training process. So that has actually started, and I stand to correction, but I think it's about 50 to 60 members have been trained in the first round of that. And there's a short way to go. And then the idea being that we'll take a step back and ask ourselves, what have we learned from this training? And then how do we roll it out to the whole province? So I think, and then all of the issues that Dr. Kluti has raised in terms of this climate of COVID, how does one train in this climate? And webinars, some of the community members might not have access to digital devices, etc. How does one overcome some of those challenges? So I think enabling the functionality of clinic committees and boards is part of our commitment to get vibrant structures in place. I've spoken earlier on about streamlining the processes. So we've now agreed to create a focal point. So that's there. In the metro and regional rural offices, we've appointed a community liaison officers, CLOs, to support this process at a decentralized level. So that's in place. So that's on the training. We can provide the information on the councillors. So that's that we'll do that. I think that largely covers it all. As far as the advertising, like Dr. Kluti has said, in the initial round to set these committees up, a lot of investment was made, newspapers, social media, radio, putting up these posters at the health facilities, the minister really championing this and distributing nomination forms, etc., in communities, etc. So a lot of that was done. But I think we do need to ask ourselves, how does one really become even more innovative in getting this going? The point about, how do we share good practice? Absolutely. I think that's a very good suggestion. And the department, as part of its own culture, is very committed to a learning culture. And I think as part of this process, we also want to do exactly that. So where there are good practices, how do we share that and get that to scale up across the province? And I think we should adopt a similar mindset in this space. I think I'll stop there, Madam Chair, unless I've not covered some questions. I could be reminded, but I think that's what, yeah. Thanks.
Dr. Vallabhji, just the appointment of the MPs onto hospital boards, please. Okay.
So as far as that goes, the legislation makes provision for that, as MPs may be appointed on the boards. My understanding from the minister is that she has extended an invitation to the Standing Committee for nominations in that regard. And I am not sure if any MPs have been appointed to date, but we could go back and check on that and check with her office. But the minister is responsible for the final appointment of people onto boards and committees. But that's been the process, that to invite nominations for boards. That's my understanding of it. Thanks, Dr. Kluti and Madam Chair.
Yes, thank you very much, Dr. Kluter, once again, as well as Dr. Vallabhji. Members, I think our questions were covered to a very, very large extent. And what was not dealt with, I noted two issues that we will deal with accordingly in our resolution. As mentioned, members, are you happy that we proceed as we have a guest that wishes to address this committee? Thank you, members. We will now.
Chairperson,
Member
are you saying, yeah, are you saying we must, you will allow us to do a follow-up, or?
Do you have a follow-up question, Member Van Vogel? I believe that
yes.
the department has covered our questions. Please proceed then, member.
Yeah. Yeah, Chairperson, I just wanted to check with the department in terms of the training to this different structures, the two structures. Are you advertising those? Are you advertising the training for NGOs to come in and train the different structures, or are you doing it internally?
Thank
using
you,
your
Member
own staff?
Thank you. Member Barnes.
Chair,
Please.
I just wanted to know if I can ask one new question, just one.
Proceed, member.
Okay, it has to do with the appointment of the clinic boards. If the city clinics that get funding from the department, are they also appointing clinic boards? If so, how many of these clinics in the province, and how will these committees be managed or monitored if they are under the city? It's the only question. Thank you, Chair.
Thank you, members. We now duly then conclude all questions from members. Dr. Kluter, Dr. Vallabhji, you may respond.
Thank you, Chairperson, and thank you to the members. I'll respond to the last question from Member Barnes. Member Barnes, the process, and one of the reasons why we also had the delay in the metro of the clustering of committees was this issue of city versus province in the metro. What we have concluded is the clustering in the metro is maybe of threefold. There's three variations of the clustering. So if we go through all of those committees in the metro, you'll find three variations. The first variations, it is clustering of facilities that only is managed by the province. That's one variation. So it is a province facility and another province facility, and they clustered or something. Another variation is a cluster where province and city facilities are clustered together. That's another variation. And then there's a third variation where it's clustering of only city facilities. So I think the point that you're making is a very important one. The minister still then appointed, or people are nominated to serve on the clusters. And we obviously collectively between the province and the city, again, one of the things we've learned, Member Barnes, out of COVID, the health response in the metro, the health response in this province has never been as unified as it's been for the last 4 months between the city and the province. So we've really learned in terms of governance how to work together as province and city around primary healthcare. But that is always an ongoing concern. The dual authority in the city and the province is something that will remain an ongoing concern until the dual authority system has been addressed. But I can give you assurance, we are working together in relation to the governance, in relation to these committees. In terms of the training, I'll ask Dr. Vallabhji just to explain to you what is being done by people management and how that training is being done by our people management colleagues. Thank you, Chairperson.
Thank you, Dr. Kluter. Dr. Vallabhji.
Madam Chair, on the training, we worked with the National Department of Health, who has appointed Health Systems Trust to do the training, and that's the process. So they've been the provider to do the training, and like I said, the materials were adapted to include some of our own legislation and regulations, and then there's a pilot process that I described previously as well. Thanks.
Thank you very much, members.
Just to add, Chairperson.
Are you covered?
Sorry, Chairperson, just to add. So we work with Health System Trust, and they are a national entity. But the idea was also that we will, via that training, also capacitate our own internal training. So it's a combination of working with an external provider that came from the national department and then also decentralized capacity in our own system. So that was the idea, but it was all interrupted with COVID, and now we have to pick it up again to say what does it mean. Sorry about that, Chairperson.
Thank you very much, Dr. Kluter. Members, we now conclude with members' questions. The rest will be dealt with accordingly in recommendations and resolutions. Ms. Kivitz, are you still with us?
Yes, I am.
Can we see you, Ms. Kivitz? Is it possible?
No, you cannot see me. I'm not going to put on my video. I'm in my PJs.
Once again, a warm welcome to you, Ms. Kivitz. Thank you for your time and for your effort within our communities as well, all the hard work that goes with it. And thank you for the time this morning for engaging with the committee. Ms. Kivitz, I will now afford you 5 minutes. I might be lenient towards in order for you to address this committee and the department. You may proceed. Ms. Kivitz?
Okay. I think for us as a Cape Metropolitan Health Forum, just to acknowledge that Mr. Lindos has also joined the meeting late. For us, there's a few key points that I would like to raise around the establishment of clinic committees. And unfortunately, Member Philander, your predecessor, MP Botha, is not in the meeting because she was the previous chairperson on that issue that we had around the establishment and the legislation that we've made lots of input in around clinic committees. And so what is important for us going forward is that pre-2016 and post-2016, what we have asked the department is to acknowledge the committees that has been around for as old as my relationship is with the department, and that's 20 years plus. So there's two things. There's the recognition that has been an issue and is still an issue, yet we do engage the department. That is why we're in this meeting. And then secondly, the reason people are not interested in serving on the committee is because how are people appointed onto the committee? I think that raised a huge concern amongst committees and members in communities, members in the forums, and then also your different levels of communication. But maybe MP Philander, that is something that we need to come back to when we have a proper sitting around this issue that we are dealing with today. I think my last comment that I would like to make is the fact that when the department came to the standing committee briefing last year, Mr. Luck was also part of that engagement. We were in committee room 2. The whole issue around the training, because we have expertise in the metro that has done training of health committees. And you can see the difference between the committees that is currently functioning in the districts and at a clinic level are the people that has come through that training. Because now with the COVID, what we've realized, and I've asked the people that has been appointed by the minister, so where are you? They said, we don't know what to do. So, and I think it's relevant that the committee has asked for a training report so that that we can see what was they trained in. Because for a member or chairperson of a committee to say, but Mrs. Kivitz, we cannot be active as you guys because we don't know what to do. So it raises a serious concern of how do we engage from a point of knowing, and then also, like Dr. Klute has said, we need to get to that point of learn the lessons. What has worked within the department? Why is the Cape Metropolitan Health Forum still around? What is it that 9 years after the late Polly Jacobs' death, we are still around? So, and the differentiation about people being appointed, because people are not sure whether it's a political appointment or whether it's an appointment of people with interest. And so we will look forward to a proper briefing session around, because this issue, Honorable Philander, is something that we need to clear and get out of the way once and for all. Thank you.
Thank you very much, Ms. Kivitz. And on that note, I also wish to acknowledge the attendance of Mr. Lindo. Thank you so much for your attendance as well. Is there anything, sir, that you would like to add to what Ms. Kivitz has said?
Thank you, Honorable Chair. Thank you for the opportunity, and thank you that we can engage. All I want to add is that I think that the department needs to, and Ms. Kivitz rightfully said, the reasons for people not being interested, the department is aware of that because we've engaged with them. We've engaged over the years with them, and we said to them, it will never work. I will not serve on a clinic committee where the MEC appoints me, because I am I'm reporting to a community, and that is the community that needs to appoint me, and that is the issue that needs to be dealt with. I need to say also to this committee that as grassroots workers, there's a lot of people that still wants to work. The department must come down to the community and engage with the right people in order to get the people to work with the department, because there's a lot of people that wants to work with the department. I want to work with the department, but as the Tygerberg Sub-District Health Forum under the Cape Metro Health Forum, we're just doing it because they have not recognized us for many years in terms of our existence and the contribution that we can give. And we want them to go back, because Dr. Klute knows what worked prior to them sort of not funding us and not recognizing anymore. It worked very well, and health committees was established and trained by the Cape Metro Health Forum as well as the department. So they just need to go back and ask what worked that time, and how can we then take the same thing that worked and implement it, because there was no issue that time. Thank you for the time given to me, Chairperson.
Absolute pleasure. Thank you very much, Mr. Lindo. Ms. Kivitz and Mr. Lindo, we as a committee do acknowledge and we appreciate your comments and your inputs made this morning. We have, at the beginning of the meeting, I've said that we will afford the opportunity for you to further engage this committee as well as the department. So we do duly take note of what has been said this morning. I will now afford Mr. Klute to do some closing remarks. Dr. Klute, anything from your side?
Thank you very much, Chairperson. We really appreciate the engagement with the committee today. We also appreciate the comments from Ms. Kivitz and Mr. Lindhorst. My concluding remark is, let me put it to you this way. I believe that COVID has changed the way we do things in every aspect of our society. I believe that COVID is giving us an opportunity to reflect, to ask ourselves, what is it that works, and how do we draw things together? I believe the answer in COVID lies, and that for me is the answer in what is let's call it universal health coverage, which is the goal that we all should aim to for healthcare, is that social solidarity is the only way to go. You have to have relationships. You have to have everybody working together in the same direction. It cannot be oppositional. It cannot be fragmented. It is health and well-being is such a precious commodity. We cannot afford to pull in different directions. So I believe in a broad coalition. I will even go as far, because I was going to share that with Mr. Muskiewicz separately, because we are going to invite her and Ms. Lindors into a reflection session for us. I genuinely believe that we need a movement, a health movement in this province. We can really set the tone in the country,
Yes.
globally, if we have a broad movement and all of us subscribe to the principles of let's call it social solidarity, that we are all in this together. We're doing it for one purpose, and that is to make sure that the most vulnerable has got an inalienable right to have the same and optimal development and outcomes that everybody else has. So I genuinely want to leave the committee with that sense. I would like to say, as a HOD of this department, if I'm around for 5 years, that is what will drive my motives as the HOD for what we want to do. Thank you very much, Chairperson.
Thank you very much, Dr. Klute, and thank you very much to Dr. Vallabhji. Again, thank you very much, Ms. Muskiewicz and Mr. Lindors, for engaging this committee. I think it's also very important for us as a committee, not just to engage in terms of the fact that we need to on this matter, but we also see and realize the importance of this very important structures in the health system as well. And thank you so much for the department for your commitment in strengthening that arm towards universal health in the province. Members, I will now then excuse the department and also excuse Ms. Muskiewicz and Mr. Lindhorst, after which we will then proceed with the adoption of our draft committee documents. Thank you very much.
Thank you very much.
Madam Chair. Bye-bye.
Bye-bye.
Thank you.
Thank you, Madam Chair. Thank you.
Bye-bye.
Members, thank you so much. We will now proceed, members, in terms of our minutes of the 13th of May. Ms. Jamke, are you putting it up? I believe members did receive their documents in time as well.
Yes, we did.
Are we getting the documents on screen, or can we proceed in that manner? Jamke?
Hi, Chair.
Is
I'm
it
still
possible
trying
for you? Okay, sure.
I'm still trying to flag the documents up.
Okay.
Desktop. For some reason, I can't.
Okay. Not to worry, Ms. Jamke. We received the documents. Members, you have checked your attendance and you have checked the document itself, the minutes of the 13th of May 2020. Can we therefore then proceed to adopt? Anyone proposing and seconding?
Can you see, Chair? I don't know whether you can see.
Yes, yes, yes. Thank you very much, Ms. Jamke. Members, can you all see the document?
Yes, Chairperson. For the 13th of May, I move that we adopt.
Thank you, Member Allen. Is there a seconder for the adoption? Members that were present at the meeting?
Chair, I lost network. I couldn't hear.
Okay, so the 13th, we are now dealing with the draft committee documents, Member Van Vogel. We are now with the standing committee minutes of the 13th of May 2020, which have been sent out and is currently on the screen. The proposal from Member Regan Allen is to adopt the minutes. Can we have a seconder?
Seconded, Chair.
Thank you, Member Van Vogel. We now proceed to the minutes of the committee meeting on the 3rd of June.
We go and get the minutes.
Thank you very much, Ms. Jamke. Please check your attendance, members. You had a briefing by the Department of Health on the TB-related cases and on the levels of children's vaccinations in the Western Cape. Are you satisfied that that is a true reflection, members?
Satisfied, Chair.
Thank you very much, Member Barnes. Is that a proposal for adoption?
Yes, Chair.
Thank you so much. Seconder?
Regan Allen will second.
Thank you, Member Allen. Members, we will now proceed to the Standing Committee minutes on the proceedings of the 27th of July. Thank you very much, Ms. Jamke. I think we must just make a correction in terms of the date, if I'm correct. Please check your attendance, members, and then we deliberated on vote 6 held in the schedule to the Western Cape Adjustment Appropriation Bill. We dealt with public input. There was no public members present. We then also considered and adopted the committee report, and then members further requested informations. Members, are you happy that that is a true reflection?
Yes, Chairperson, and I propose that we adopt the report.
Thank you very much, Member Bosman. Seconder?
Second, Chairperson.
Thank you very much, Member Van Vogel. We now proceed to the committee annual report for the 2019-2020 financial year. Are you happy, members, that we can adopt?
Regan Allen, happy Chairperson. We can adopt.
Thank you, Member Allen. Second. Can we have a seconder for the adoption of the activity report?
I second that.
I second.
Thank you, Member Bosman. We now proceed, members, to the quarterly report for the period January to March 2020. Are you satisfied members in terms of the committee meetings that was held. We had the one meeting that was postponed. There was no annual reports reported on during that period. We dealt with the budget vote. Please check also your attendance, and there was no legislation referred to you during that period. Are you happy, members? Can we adopt?
Yes, Chairperson.
Thank you very much,
I
Member Van
propose.
Vogel. Seconded by? Seconder? Is there a seconder to adopt?
Regan Allen.
Thank you, Member Allen. We now proceed, members, to the committee quarterly report for the period April to June 2020, of which the report also make notes of the two committee meetings held. There was no annual reporting during that period, no budget vote during the period. Please check your attendance, members, and there was also during this period no legislation referred to. Can we adopt as such, members?
We can adopt, Chairperson.
Thank you, Member Allen. Seconder.
Barnes.
Thank you, Member Barnes. We now proceed, members, to the last draft document, which is the committee tracking document for the 2020-2021 financial year. Members, are you happy that we can adopt the report or the document, the tracking document?
We can adopt, Chairperson.
Thank you, Member Allen. Seconded.
Second, Chairperson.
Thank you very much, Member Van Vogel. Members, that now concludes our draft documents that has been duly adopted. Members, according to our business of the day, our presentation by the department, you are now welcome to list your resolutions or recommendations. Members, from my side, I have noted, and Ms. Jamke must just assist us in this, that the members wanted to know in terms of councillor participation in this committee, as well as the councillors, were they that participate, and the feedback on their participation. And the other resolution noted was also the nominations for members on these various boards. You must just word it correctly. Is there anything from your side, members?
Yes, Chair. If I can perhaps just add on the latter of the members of the nomination of the members. I think we've got an explanation, but I'm not yet 100% clear because they said it's within the minister's component to do that. If perhaps we can get the minister to explain to us the process because it was referred to her, and if they are already, if perhaps we could get a template or her coming to tell us that which members are appointed and where, because we also have interest. We want to know what's happening around our areas. And another one was on the question that I asked for the list of the functional hospital boards and clinics. If we remember that the presentation was more numeric, we were given numbers. Perhaps if we can get a request of the names of the hospital and not just, for example, West Coast 7, who is the 7, if we can get something like that. Thank you, Chair.
Thank you very much. If I understand you correctly, Member Barnes, we will then request the department for the process and procedure in terms of members' appointments to the various boards. and then also the functional hospital boards and clinic committees in the province. Of course, those not functional stated then as well. Is there anything else from your side, members? Any recommendations or resolutions from any other member? Thank you very much, members. Yes, Member Bosman.
Maybe
Please proceed, member.
If I could ask if the department can provide us with the procedure that each council, municipal council follows in terms of appointing board members, and also whether they have reached out to ward committees, since they're struggling to get interest from the public, whether they have ward committees. And I'm not sure, I cut off a little bit there, I'm not sure Member Barnes may have asked this, but if we can get a list of a breakdown in the different district municipalities of hospital and clinic boards that are functional and not functional, and also who those members are, please.
Yes, the letter was covered by Member Barnes. Yes, thank you, Member Bosman. We will then add your resolution to the segment of councillors' participation. Member Van Vogel?
Yeah, Chair, mine is not, it's just clarity, because it was mentioned by the HOD about a notice that we received for MPs. Did the standing committee receive such notice?
Thank you, Member Van Vogel. We will ask the procedural officer to come back to the committee on what the HOD has stated in terms of the notice that was provided to the standing committee. And I think latching onto that also, that we are asking what the nomination process entails in order for all of us to understand that as well. Is that fine with you, Ms. Jamke? You've captured?
Yes, Chair, but if I can have a say, in terms of the minister sending the info to the committee, I do not remember that one, unfortunately.
Okay.
So, yeah.
Yes. So our rule, Ms. Jamke, that we go see in our records whether we have received, but also in totality we address in terms of what the process entails when it comes to members being appointed to the various boards. Are you happy, members?
Yes, just to add that we make a point that in future that we need to get that information as a standing committee. Thanks, Chair.
Thank you very much, Member Van Vogel. Members, I believe that concludes our business for the day. We've dealt with briefing, we've dealt with the adoption of our documents. At this point, I wish to thank you very much for your valuable input and for your comments. And for now, in terms of this part of our committee business, we have a clear way, we have a commitment by the department, and we know that we have dedicated members of the community that has the passion in order to strengthen the health system within our province. I also wish to thank Ms. Jamke. Thank you so much for your support, all WCPP officials. Members, we will now then conclude and adjourn the meeting. I wish you a blessed day and a blessed week ahead. Please keep safe and please keep warm. Thank you to everyone. Thank you.